So don't have to worry much about it. Absolutely no withdrawal effect. You can commence and stop the therapy with this peptide without any implications. Nothing to worry about. Very safe, very effective. Another novel peptide is called Body Protection Compound 157, BPC 157. In one of the studies, BPC 157 gave 91.6% significant improvement in knee joint pain after a single injection. Okay, so BPC is a beautiful molecule. It's a natural occurring decapeptide that is initially found in the gastric juice. So we as humans were producing this peptide, but in a very small, tiny quantities. And about 20-30 years ago, in early 90s actually, this molecule was deciphered and now available as a pure synthetic molecule, but it's a 100% naturally occurring molecule that is in natural condition is providing the repair for the gastrointestinal tract. And the oral forms of the BPC are very good for patients with colitis, with gastrointestinal issues, inflammatory bowel disease and all, or even Crohn's disease. It's one of the indications in surgery for the anastomosis, for the inflammation after the bowel resection and anastomosis. It is used, but it also producing massive beneficial systemic effects, such as the neuroprotective effect. It's a very potent agent against neurotoxicity, against depression. It promotes neurogenesis, but mostly what it does, it promotes a tremendous healing, wound healing, ulcer healing, the healing of the muscles, tendon, bone healing as well. Yeah, so it has multiple pleiotropic effects. It's very safe if you want to run it systemically. Usually it's 4 to 6, maybe 8-week cycle. Then give at least 2 weeks of rest, or maybe even the duration of the rest between the two protocols can be as long as the protocol itself. So if you're running systemically BPC 157 say for 6 to 8 weeks, then you can make another 4 to 6 weeks break to desensitize receptors and then repeat the cycle again. And in that way you will not lose the efficacy of this compound. Slide 39 talks about the CJC 1295 and also its modified analog known as the ipamorelin. It's the CJC with a slightly modified molecule to increase the affinity of the drug to the tissues, to prolong the half-life and increase the bioavailability. And these two peptides, they act together to release natural growth, human growth hormone, which is an excellent stimulant for connective tissue healing, including bone, tendon, and ligament healing. And a CJC 1295, it imitates natural growth hormone releasing hormone peptide, while ipamorelin is an analog of the natural ghrelin hormone that acts on the pituitary gland. By combining either peptides with a synergistic effect, for instance, by combining CJC 1295 with the BPC 157, it is possible to upregulate growth hormone receptors on cells like tenocytes, it's a tendon cells, to stimulate tendon repair and help regenerate and lay down more collagen for repair. This combination of peptides augments the natural growth hormone production, its storage and pulsatile release without the typical downside of the exogenous growth hormone or the similar peptides administration. Also without the increased cortisol, without the increased adrenocorticotropic hormone, increased prolactin, without those hunger, the episodes of extreme hunger that may be associated with that. In the same time, many patients, they report somewhat suppressed appetite with that promotes weight loss, better quality sleep, improved cognitive function, and